Good morning, this is me Nafisa, and today we'll be learning about enteric coating. Drugs are most commonly taken orally, that is, through the mouth by patients in tablet form or in capsule form. The drug, that is, the tablet or the capsule, from the mouth passes through the esophagus and reaches the stomach, where the drug first disintegrates, then dissolves, and is then passed on to the intestines, from where the drug is absorbed into the bloodstream to reach its target site to show its action. Absorption may begin in the stomach for certain drugs, but most drugs are usually absorbed from the small intestine. This is what happens normally. Sometimes we don't want the drug to disintegrate and dissolve in the stomach, but we want it to move to the intestine, where it should disintegrate and dissolve and show its action. Since we want the drug to pass through the stomach unaltered and reach the intestine, so we give a particular coating on the drug. This coating will ensure that the drug is protected or is stable in the acidic pH of the stomach, or we can say that the coating on the drug will not disintegrate and dissolve in the acidic pH of the stomach. But this drug breaks down rapidly at a higher pH, alkaline pH of the small intestine. This type of coating is called as enteric coating. The word enteric comes from the word enteral, meaning small intestine. Therefore, enteric coatings ensure release of medicines in the small intestine. Summarizing what is enteric coating. Enteric coated drugs are meant for oral administration. Enteric coated drugs are medicines coated with substances that do not disintegrate and dissolve in the acidic pH of the stomach, but readily disintegrates and dissolves in the alkaline pH of the small intestine. That is, drug with enteric coatings will bypass the stomach and will be released in the small intestine. Please note, enteric coating are polymer coatings which are insoluble at low pH but soluble at high pH. As enteric coated tablets are designed to remain intact in the stomach, therefore enteric coated tablets should never be cut or crushed. Otherwise, this will expose the drug to the stomach. Now, let's learn the benefits of enteric coating. Some drugs, such as enzymes like serratiopeptidase and a class of drugs, proton pump inhibitors, molecules of which are pantoprazole, rapiprazole, are unstable or are inactivated, or we can say that they are destroyed in the acidic pH of the stomach. If these drugs are already destroyed in the acidic pH of the stomach, thus these drugs will not be able to show its therapeutic efficacy. For example, pantoprazole, rabeprazole are drugs which stops the stomach from producing acid. But if these itself are broken down in the acid, then this drug cannot show its action. So the need is that these drugs bypass the stomach and are released in the small intestine so that it will be able to show its therapeutic efficacy or action. Therefore, the first benefit of enteric coating is enteric coating helps to protect these acid labile drugs from being destroyed or degraded by the acidic pH of the stomach. Drugs such as aspirin and certain non-steroidal anti-inflammatory compounds have an irritant effect on the stomach and hence cause side effects such as gastric irritation and bleeding. Enteric coatings prevent these drugs from dissolving the stomach, and when the drug reaches the neutral or alkaline environment of the intestine, its active ingredients can then dissolve and become available for absorption into the bloodstream. Hence, the second benefit of enteric coating is to protect gastric mucosa from the irritating effects of the medication itself, thereby minimizing the side effects. Certain drugs like doxylamine, although taken at bedtime, but the need is that maximum concentrations of doxylamine should be achieved in the early morning hours when it is needed the most. Enteric coating ensures that the active ingredients are released in a pH dependent manner along the small intestine to provide relief from nausea and vomiting. So, the third benefit of enteric coating is to provide a delayed release effect or strategy for nighttime dosing. Enteric coatings are applied to garlic or fish oil supplements, The coating prevents the fish oil capsules from being digested in the stomach, which causes a fishy reflux or fish burps. Fourth benefit of enteric coating is may prevent the unpleasant side effects. Drugs such as some antihelminthics may need to reach a high concentration in a specific part of the intestine. Enteric coatings are employed so that the drug bypasses the stomach and drug absorption is substantially enhanced in the intestine. Fifth benefit of enteric coating is to deliver drugs that are optimally absorbed in the small intestine in high concentrations. Summarizing benefits of enteric coating. First benefit of enteric coating is to protect acid labile drugs from being destroyed by the acidic pH of the stomach. Examples: serratiopeptidase and a class of drugs, proton pump inhibitors, molecules of which are pantoprazole, rabeprazole. Second benefit of enteric coating is to protect gastric mucosa from the irritating effects of the medication itself, thereby minimizing side effects. Example: aspirin and certain NSAIDs. Third benefit of enteric coating is to provide delayed release effect or strategy for nighttime dosing. Example: doxylamine. Fourth benefit of enteric coating may prevent the unpleasant side effect. Example: fish oil supplements. Fifth benefit of enteric coating is to deliver drugs that are optimally absorbed in the small intestine in high concentrations. Example: antihelminthics.